Good evening and welcome. I'm Cherish Thompson, Public Affairs Specialist for the Sheridan VA Healthcare System. Thank you for joining us for our virtual Women Veterans Town Hall this evening and for representing the communities across our cowboy state. Tonight we'll be talking about women's health care coordination, from maternity care and women's health screenings to menopause, symptoms, and treatment. Joining me tonight is U.S. Air Force veteran and our acting Women Veterans Program Manager, Sue Calentine. Good evening, Sue.
Good evening, Cherish. Thank you.
Thank you. Sue is the Women Veterans Program Manager from Montana, and she brings to Sheridan 10 years of experience serving women veterans in that role and as a women veteran herself. Also presenting this evening is our Women Veterans Health Coordinator and registered nurse, Cindy Lowe. She is also the Maternity Care Coordinator. And also joining us tonight is Montana's gynecology nurse practitioner, Carrie Cunningham, who's joining us to present and answer questions as Lacey Little could not be with us tonight. Janine McNeil, your Women Veterans Peer Support, will present some upcoming opportunities for connecting with other women veterans. Hi, Janine. Thanks for joining us.
Hi, thank you.
Also joining us is our Chief of Staff, Dr. Eric Crawford, and our Associate Director of Patient Care Services, Ms. Andrea Henderson. Thank you all for joining us tonight.
Yeah, glad to be here.
And I wanted to invite a few moments to just let our executive leadership team see if they have anything to share with you this evening. Dr. Crawford?
Sure. Thank you, Cherish. Hi, everyone. This is Dr. Crawford, the Chief of Staff here at the Sheridan VA. I just want to welcome you all to the call. I'm delighted to have this opportunity to interact with so many women veterans throughout the state of Wyoming and beyond on this call tonight. We're going to have the opportunity to share some critical information with you about resources, services that are relevant for women veterans, and I'm excited for you to have the opportunity to engage with our team, our Women Veterans Program team and partners. And women veterans, the subpopulation of women veterans here in Wyoming and really throughout the country is one of the fastest growing subpopulations of veterans that we have. So it's an absolutely critical priority for this healthcare system to ensure that we are taking steps and actions to best meet the needs of women veterans wherever they reside in our state of Wyoming. An example of that effort that I'm excited to let everybody know about tonight here at the outset of the call is that we recently hired a brand new physical therapist here at the Maine Medical Center in Sheridan that will specialize in pelvic floor therapy and other services that are super relevant to women veterans. So we hope that you will all have an opportunity where relevant to engage with that new physical therapist. Her name is Amy Legursky. So please engage your primary care teams and staff if you think those services could be relevant. So just wanted to give that announcement at the outset here, and we'll be happy to answer any questions that arise throughout the call, and we'll hand it back to you, Cherish, and the team to get into the information sharing for the evening.
Thank you.
Yeah, hi, this is Andrea. I'm the Associate Director for Patient Care Services Nurse Executive, and this week I'm the Acting Medical Center Director, so I'm kind of filling in for Mr. Gill, and I just wanted to thank our Montana partners for really kind of shoring up this team as we go through some transitions, and we are so grateful for all the partnership that they provide to us for our Wyoming veterans during this season of change. So we will look forward to any questions that you might have.
Thank you, ma'am. We'll start out tonight with presentations from our Women's Health Program team, but if you have any questions that are relating to women's health, you can press *3 at any time on your telephone to get entered into the call queue. As there can be hundreds of people possibly on this call, please keep personal medical information and sensitive issues that are not appropriate to share out of this call. If you have those type of nature of calls, you can let the screener know, and they can put a note, and we can follow up with you after this call if you need to reach out to somebody or have someone call you back. If we'll be trying to reach back out with folks that don't have their questions answered tonight within about 2 business days. If you are joining us this evening via the Access Live portal or on the telephone and are triggered, struggling, and/or wish to speak privately with one of our VA team, you can request one of the VA team screeners. If you are in crisis or in need of immediate help, please press *0 during this call and you'll go straight to the Veterans Crisis Line. So let's get started. Tonight I'm first starting out with introducing again our Women Veterans Program Manager, Sue. I'm excited for you to meet Sue as she brings with her 20 years of VA experience in a variety of roles. And as a veteran herself, Sue brings a lot to the table in her acting role here in Sheridan. Good evening, Sue.
Good evening, Cherish, and thank you again. As Cherish said, I am an Air Force veteran, and I'm very excited to be your Women Veteran Program Manager and working with our fabulous Sheridan team. Thank you tonight for joining us. But why are we here today? Why do we do these town halls? It's an opportunity for you to hear what's going on with the Women's Health team. Dr. Crawford already shared a bit of information about Amy Legursky, our pelvic floor coordinator. It's also an opportunity to learn about maybe healthcare services that you didn't know we are able to offer, and also a chance for you to meet and hear from our Women's Health team. It's also a time for you to ask questions of us. So the team here working very hard on improving access and overall services. We want to make your healthcare experience one that's more sensitive to your very specific needs as a woman veteran, and to ensure it's high quality. While we as women veterans remain a minority of all veterans overall, you still deserve the same level of services provided to any male veterans, and that's our goal. We are all here to ensure timely, equitable, high quality, and comprehensive healthcare services in an environment that makes you feel welcomed and safe. And speaking of other services, besides Amy Legursky, did you know that we have a women's health liaison in every clinic? This person is a nurse, and she's an extension of the women's health team, and somebody that when you come in can answer your questions and assist you when you visit. A full list of our women's health liaisons are listed on our Sheridan website page, so take a peek at that. Let's talk about numbers and growth for a minute. Since 2002, the number of women veterans overall has tripled. We made up 4.4% of the veteran population in 2002, and by 2024, that had increased to over 11%. In 2024, over 700,000 women veterans were seen at the VA. Today, that's estimated to be over 1 million women veterans or close to it. But let's look a little closer to home in Sheridan, our catchment area for Sheridan. There are over 2,500 women veterans in the catchment area for the Sheridan VA and the clinics. The number of enrolled women veterans have increased by almost 15% in 2021. The average is 3 to 5%. So Sheridan is way ahead of that growth. Almost 1,300 women veterans are enrolled as of 2025. That is very, very exciting. Again, one reason why we like to hold these town halls and provide information that we have for everybody. Another did you know October is Breast Cancer Awareness Month. During this month, we would like to encourage you to talk to your PAC teams, your provider, about your risk of breast cancer. And let's talk about that a little bit. 1 in 8 women will be diagnosed with breast cancer. Breast cancer is currently the second most common diagnosed cancer in women and the second most cause of death in American women. Black women are more likely to die from breast cancer than other races and ethnicities. And the risk of breast cancer increases with age. So early detection is the key. Mammograms can find breast cancer early, and the earlier cancer is found, the easier it is to treat. Now, both the American Cancer Society and the VA no longer recommend routine breast exams. Always tell your VA healthcare provider, however, if you've noticed any changes in your breasts. While there is no direct link between deployment and breast cancer that's been found, VA is continuing to do studies to determine if toxic exposure may be a cause of breast cancer. And the Service Act guarantees that any veteran who served in designated combat locations during specific periods will receive breast cancer risk assessments and undergo a mammogram. Now, we talked about screening. VA follows the United States Preventative Services Task Force, or you might have seen acronyms. We love our acronyms, right? USPSTF, breast cancer screening guidelines. Happened a couple of years ago. So what are those? Women should begin getting mammograms by the age of 40. Women aged 40 to 74, a screening mammogram is recommended every other year. Now, that doesn't mean that you can't ask for those mammograms on a yearly basis. Again, please talk with your primary care provider. Women 75 years or older, speak with your healthcare provider about any risks or benefits of screening to find the right plan for you. Now, October, we think of candy, trick or treat, everything else, but we have some very important women veteran health teaching kitchen news to share. Did you know that we have a women's health dietitian? Her name is Olivia Feaster. She holds women veterans virtual cooking classes, and the next one is next Thursday, October 30th, from 11 to 12:30 p.m. She's going to be going over recipes for enchilada sauce, honey chipotle slaw. I'm getting hungry, so I'm going to stop. Olivia also has cooking kits available for women veterans who could use some additional kitchen supplies at home to support them. So please, if you have any questions, want to join this group, please reach out to Olivia Feaster, registered dietitian. Her office phone number is 307-675-3927. Well, that's all I have right now, Cherish. Thank you.
Thank you, Sue. And I wanted to let the rest of you know that Olivia is also on this call tonight, and she would be available for any questions you might have. Again, you can hit *3 at any time to be able to be put into the call queue with any questions. Thank you. So next up is Ms. Cindy Lowe, our Women Veterans Healthcare Coordinator and our Maternity Care Coordinator as well. And she'll be presenting on both of those topics this evening. Hi, Cindy.
Hi, Cherish. Thank you. Hi, everybody. First, I wanted just to talk a little bit about maternity care. I think that that's still a service that the VA offers that not everybody's aware of. So, and all of our maternity care at the Sheridan VA is done in the community. So the consult, if you're pregnant, you had a maternity care consult, essentially is going to cover everything that is medically indicated for pregnancy. So that's all evaluations and labs, all imaging, all screenings, prenatal and postpartum, consultation services that are clinically indicated, such as anesthesia, any studies and procedures for prenatal complications, labor delivery, including the hospital, inpatient, outpatient, newborn care. So that actually is date of birth and the 7 consecutive following days. So you have a boy and you'd like to have him circumcised, that also would include that. The consult itself also covers 8 weeks postpartum follow-up visits, so that would be with your OB, and any postpartum contraception. One thing that's not listed on the consult, I believe, is that our phone program, our maternity care phone program, which is part of my job, includes follow-up calls for 1 year postpartum, so when the baby is a year old. And that's just a kind of a new addition to the VA coverage. Then for breast cancer screenings and the cervical cancer screenings, all imaging, all of our breast imaging, and most all of our cervical screenings are done in the community. And that process is because I think sometimes it gets pretty confusing and difficult to navigate, so maybe providing a little information would be helpful. The consults and the orders are sent into the community. They're sent to the community provider. It's their responsibility to let us know when your appointment is. That's a challenge sometimes to get that information, but then we'll at least know when to request records. So any abnormal results, reports, I actually follow up on all of them, but the abnormals, I'll write the orders and give them to the providers so that they can be sent. And then we start over in that process. Once I receive the results, then we look at what the recommendations are for next year, and I put it in a tracking system, and we start again. I think one of the biggest challenges, or two of the biggest challenges with our community care providers, is not being notified of the appointments. And then we find it very challenging at times to get the records, even after multiple requests. And I'm sharing this with you because sometimes my notification of results is delayed, and it can it can cause some delayed care, say if the results are abnormal. So I'm just going to encourage you to advocate for yourself, and don't hesitate to call. So call the provider, call your primary care team, or call Women's Health. And then one last thing I just wanted to share with you. At the end of the year, I'm going to be retiring, and I just wanted to thank you for the honor of working with you for the last 7 years. And don't hesitate to reach out in the meantime if you have any questions or concerns. Thank you very much.
Thank you, Cindy, and congratulations on your upcoming retirement. We're going to miss you. If you have any questions, anytime again throughout the evening, you can press *3, and we'll put your calls into the call queue through the screeners. Next, I'd like to introduce to you Carrie Cunningham, the Montana VA's gynecology nurse practitioner, and she's presenting tonight on menopause, states, symptoms, syndromes, and treatment. Good evening, Carrie.
Good evening. Thanks for having me. I am, as they said, the gynecology nurse practitioner in Montana, and I did check with your Women's Health Medical Director, Lacey. She was sad she couldn't join us tonight, but made sure that everything that I'm talking about is in line with what she agrees with, and hopefully we can help encourage women to get some help with their potential menopausal state. So what is menopause? Menopause, the official definition of menopause is 12 consecutive months without a period. So if you go 11 months and you have a period, that clock starts right back over, unfortunately. Surgical menopause is if you've had both of your ovaries removed with or without having your uterus removed. That puts you directly into menopause as well. The menopausal transition is when you start having more than a 7-day variation in your period cycle lengths. Late menopausal transition is not having a period for 60 or more days at a time. So perimenopause is that transition plus the 12 months after your final menses or period. The reason we care most about what the menopause definition is because if you are to have bleeding after that 12-month period, then it's considered postmenopausal bleeding, and that's of concern, and your provider needs to know about that. However, your periods don't dictate the symptoms that you're having in terms of perimenopausal and menopausal symptoms, so the treatment for all of that can occur and frequently should occur prior to that full 12 months without a period. So what are those symptoms? Everybody knows them, right? I like to refer to it as death, taxes, and menopause. Every woman's going to get through life with menopause, whether we like it or not. Those symptoms include hot flashes, night sweats, sleep disturbances. Often poor sleep is one of the main things that women come to me talking about. Brain fog, that abdominal weight gain. My mom likes to say that her weight shifted. You know, it went from the top to the middle. Some women will experience heart racing, changes in their moods, increasing, changing depression and anxiety, energy changes, self-esteem changes, as well as hair changes, losing it where we want to keep it and finding it in places that we don't want to find it. The genitourinary syndrome of menopause is really associated with the vaginal tissue. All of that vaginal tissue is incredibly estrogen sensitive. So women who are even being treated for symptomatic menopause, if they're not getting estrogen replaced directly in their vagina, they will experience vaginal dryness, painful intercourse, and frequent urinary tract infections. Some of these things can be very well helped and managed, at least discussed with that new pelvic floor physical therapist. So I'd love to put a plug in for her. I very heavily rely on our pelvic floor physical therapist, and my patients very much love her. The treatment for both of these varies just a little bit, not a little bit, quite a bit. So there are hormonal management of menopausal symptoms. That includes generally estrogen and progesterone. Some women who do not have a uterus are not using progesterone, but women who have a uterus must have progesterone in order to minimize and mitigate the symptoms, the potential of developing an endometrial hyperplasia or a thickening of that uterine lining after you've had menopause, which can lead to endometrial cancer. So we really have to use that to protect women. The studies are coming out and very rapidly and resoundingly mitigating and disputing the findings from the Women's Health Initiative. So really what we know is that using estrogen after or during perimenopause and for menopausal women helps decrease the risk of dementia and heart disease as well as osteoporosis and dramatically increases the quality of life of women. Just because all women have to experience it doesn't mean that there's a prize at the end for getting through without any help. So please, 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 if you are having symptoms of menopause, please talk to your provider. Lacey specifically is there to help potentially some other PACT providers. I unfortunately don't know all of the resources available to you, but if you are experiencing symptoms, please talk to someone about that. Some women do not qualify and should not have hormones. That doesn't mean we want to ignore your symptoms. It just means that we have to use different medications. There are many non-hormonal medications that are very effective for managing these symptoms. So even though you're worried about hormones, or maybe you have medical conditions that eliminate hormones from the use in you, it doesn't mean you have to suffer with your symptoms. When we go back and talk about those genitourinary symptoms, vaginal dryness, painful intercourse, frequent UTIs, that is managed with vaginal estrogen. And the American Urology Association recently released a position paper encouraging the use of vaginal estrogen in all postmenopausal women for the entirety of their lives. It helps decrease the risk of urinary tract infections by 50%, and unfortunately we have women dying of septic bladder infections in America every day. So really is a life-changing, life-saving intervention that's very easy and pretty cheaply managed as well. So I suspect I instigated some questions. I'll remain on the call, of course, to answer any of those questions, but I hope this is helpful. Thank you for your time.
Death, taxes, and menopause. I am not looking forward to that. It's so much fun stuff to look forward to. But I am excited for our women veterans that they have a good support team here to help them out. Thank you very much, Carrie. Again, you can put *3 to put those questions in to Carrie or any one of our women veterans team this evening. So please take advantage of that. From our peer support team is our Army veteran and our women peer support specialist, Janine McNeil, and she has a few things to share with you about upcoming activities. Good evening, Janine.
Hi, Cherish. Hello out there, and thanks for popping on and seeing what your VA's got to offer. I think having this is very important because I'm sitting here realizing, boy, I missed out on a lot of things due to the menopausal and not having, PCP during that time through the VA. So now I'm sitting here thinking, boy, I need to get checked out. So you ladies make sure you get in here and get things taken care of. So a little bit about my position. As Cherish told you, I'm an Army veteran, and I've been blessed with a life that has enabled me to be able to be of continuing service to my fellow sisters. And how I do that is I offer groups, and I offer those groups in person and also via our BBC. So that way I have a wider range where I can keep us connected, because that's a huge thing out here in Wyoming, Montana area. One of the most important groups that I do feel that I have is the MST support group. That's been going on since I've been here, and I've been here for 3 years now. I'm lucky enough to be able to lead that group, and there's a different, that varies in your healing journey. If that is something that you feel you might benefit from, please feel free to reach out, and we could do, I just like to gather some information to make sure that that group is suitable for you. It's mainly, a social and a goal-oriented group, so we like to move forward. One of the other groups that I currently have right now is a self-love group, and that just gives you the tools to redirect your negative thinking patterns. And I do provide the book for you. So if you're interested in that, that's on Tuesdays from 10 to 11:30.
How do they get a hold of you, Janine? Do they call you directly? Do they schedule that through another caregiver? What's the best way to?
Yeah, you can reach out to me directly by my email, which is janine.mcneil@va.gov, or you can reach me at 307-675-3844. The future groups that I do plan on having, you're actually coming up here pretty soon. Connecting Through the Cold. I held this group last year, and what that was an assigned art craft project that I would mail to you, and we just got on via Teams and just chatted. It's about a two-hour group once a month. I will be getting some information out concerning that here in the future. Writing to Wellness, that's not a journal writing class. However, it's actually taken from peers that created this book using prompts that we felt gave you the tools for your healing journey, as far as a reflection and how to respond to certain situations. It's an amazing group. I can't say enough about it. It's one of my favorites. So if you're interested in that, please feel free to reach out and let me know. We will be having a book club that will be starting in January, and I've already selected 2 books that I think would be interesting. Where is Bernadette Now? Or Where Are You, Bernadette? It's cute. I watched the movie. Don't cheat, though. You got to read the book. And the other one is a bit more intense, and it has a workbook. It's Women Who Run with the Wolves. But I think it's pretty powerful. And then I will be bringing on board Moral Injury for trauma survivors. I have found that that those of us that have survived traumatic injuries definitely need to deal with the moral aspect of our symptoms. And then the Art Expressions group. I need a very talented clinician to assist me with this, because the impact of this group is very powerful. But it would be a at least an 8-week long ARCH project. That group, however, would be held in person. So I hope that would spark some interest. And you don't even have to be artistic, because I'm not. so
That's it.
I'm
Thank you, Janine. That's awesome. Lots of good stuff happening and opportunities to connect and meet other women veterans if you are not plugged in with the community. I wanted to also bring you back around to Sue to finish us out before we get into questions. But again, Janine said she had her email and she spells her name kind of unique, so I'll put it out there for you if you have a pencil. And that's JEANINE, and that's dot McNeil, MCNEILL, at va.gov, and she'll be able to help set you up with one of these opportunities if you're interested. So thank you. Okay, Sue, if you'd like to take us through the last couple of things, and we'll move on to questions.
All right, thank you, Cherish, and thank you to all of our presenters, the Women's Health team, Carrie for pitch hitting for Lacey. Certainly appreciate all the outstanding information everybody shared. We want to help however we can. So one of the ways that we like to hear from you outside of the questions that you might have at the town hall is our focus group. Now, focus group, very, very different than our town hall. Focus group, very intimate, very small, 6 to 9 veterans. Our next one we're holding in either November or December, and we'll get that information out to you. We haven't quite nailed down the time yet because of the holidays and such. But Brianna can be reached. She's the one that puts your name on the list and pushes out all the good information about the focus group to you. Her phone number is 307-675-3712. And again, that's Brianna, 307-675-3712. Call her, let her know that you're interested in being part of the next focus group. We'll put you on the list. You can also leave her a voicemail if she's not in the office at the time. Also reach out via My Healthy Vet. Now, what can you expect? Again, very small group, 6 to 9 women veterans. I ask questions about your care, the environment. Do you feel safe? Do you feel respected? How we doing? Rate us. What do you need from us? What else can we provide? And we really want that feedback to continue. As I always used to say, we can't fix it if we don't know it's broken. So we really want to hear from you. One of the other resources for women veterans is She Wears the Boots podcast. And so there's a lot of good information. They have different podcasts all the time about different topics and such. So that's another resource for everybody out there. And also the Women's Call Center. That is available weekdays and on Saturdays. To be honest with you, most of those ladies that answer the phone, or many of them, are women veterans themselves. If you're ever having trouble getting things done, have questions, you're not able to get a hold of any of us, that's there for you as well. So that's, again, another resource. Let me share with you the podcast email address. It's podcast intaker request at va.gov, and that's to ask questions or comments for that podcast. She Wears the Boots. It's just really good information for you. So, all right, Cherish, now I think we can start taking questions, ma'am.
Yes, thank you, Sue. Appreciate that. And again, we got Sue on the phone, Olivia, Janine here with us, Carrie for the medical questions, and Dr. Crawford and Andrea are here as well. So again, hit *3 on your phone if you'd like to be entered into the call queue. But if you are triggered at any time, you can press *0 or ask to speak to one of the VA team screeners. They're right here. They're one of our patient advocates, and they'd be glad to speak with you. All right. We have a couple questions right now, and I am going to go live with Catherine from Buffalo. Hi, Catherine. Do you want to ask your question?
Well, I have two. Hi, how are you guys tonight?
Hi.
I have two things. Okay, down here in Buffalo on November 10th at 10:30 at the Buffalo High School, they're for the Veterans Day program, they are honoring all female veterans.
Nice.
So they have a little skit. They always have a little skit all the time, and then they feed us afterwards. So that's the best part. You know.
Thank you.
So if y'all want to come on. We have a lot of fun. But anyway, okay. I just saw my primary care doctor. Now you got to remember I'm 75. Okay. And the nurse asked me if I wanted to have a mammogram, and I thought that was kind of weird, and she goes, "Well, usually over 75 you don't need one." And I told her, "Yeah." So anyway, I got my appointment and everything else. But I just thought it was weird. I mean, us older women, they act like, well, you're already past your age and you should be in the grave, Maybe I shouldn't say that, but,
Do you?
Sorry.
Hey, no, you're fine. You're fine. I was just wondering if Sue or Carrie, do either one of you want to take that or the recommendations that you're aware of?
Hi, this is Carrie. It unfortunately does get a little bit gray as women get a little bit older, and I believe the guidelines do say at the age of 75 a woman can stop. However, there's no hard and fast rule. Every 75-year-old is not the same as another 75-year-old, and honestly, if you feel more comfortable continuing, then just continue. No one's going to tell you you can't.
Okay, that's no problem,
Yeah.
So.
Yeah, and that's what I'd add. Thank you, Carrie. Is you always have that option to say, hey, yeah, I'd like it. I feel more comfortable about it, and just have that conversation with your provider, and because the guidelines have recently changed, but certainly if that's something you're interested in, like Carrie said, absolutely say something to us.
Well, the thing is, like 2 years ago, I had to have it felt like they had a needle that was like 3 foot long, I know I'm exaggerating with that, but, it kind of scared me. So I thought, well, I think I should continue on with the mammograms.
Thank you.
Absolutely. That sounds like there's no reason not to, but yes, continue.
Okay.
All righty. Thank you very much. Next we have Maria from Cody. I also want you to know, though, we do have room for questions, so please feel free, if you're dying to ask a question, go ahead and hit that *3 on your phone so that you can ask those questions. And hi, Maria, would you like to ask your question?
Hi, yes. I'm in perimenopause, and it's driving me nuts, like it drives most people nuts, obviously. I went to my provider to try to get a referral outside of the VA system because the provider I would like to see is a private practice, and I do have TRICARE as well, and I'm having trouble getting a referral straight to the private practice because they keep trying to go through the VA system, and they keep referring me to a VA provider. And I don't know how to get it straightened out where I can see a provider because they require a referral from my primary care provider, which is a VA provider, for me to see them. But I can't figure out how to get my VA provider to just write a referral straight to the private practice one so I can use my TRICARE.
Okay. Hi, Cindy. You're on, right? Is that something that you'd be able to assist her with, or something that you could tell her a little more about how to get that done?
Yes, probably I can help if I could just get your information, but not right here on this line. I'm happy to give you a call tomorrow and work through this with you.
And we'll pass that information on to you then, Cindy, because we have her phone number and we'll be able to follow up then tomorrow. Thanks,
Okay.
Maria. And Dr. Crawford had a little bit.
Yeah, I just wanted to jump in and make it clear that if you do have a VA PCP and you're experiencing perimenopausal symptoms or symptoms of menopause, that's absolutely a conversation to have with your primary care team. And we do have means through which we can consult for specialty care in the community. The most reliable way to start that is to engage your primary care provider and team directly and to have that conversation.
And they've done all the blood work that is required and everything that the private practice requires. So they've actually done all that for it, but they just haven't got the referral to the correct people, unfortunately. And it's going on over a month now, and it's driving my husband nuts. And he's like, "What's going on with it?" I'm like, "I don't know."
Sure, and I suspect that we can provide some assistance and aid through Cindy, but also through our business office representation. So we'll make sure we do that after this call.
Thank you, Maria. Appreciate that. We have Miss Olivia Feaster on the line, and we thought it might be nice for you to be able to hear from her directly a little bit more about that Helping Teaching Kitchen and what that whole process is like, and try to entice you, besides the yummy food she mentioned, what might be available to you through this program. Hi, Olivia.
Hi, yes, I would love to talk about it because I'm always looking for more women veterans to join us. I have it arranged as a VVC class. So it's a video or virtual class, and it can be a cook-along class. So I send out the recipes ahead of time, and if you'd like to get the ingredients, we can all cook along together. I've also had women join and just watch and participate with questions and join in that way too, which I welcome either way. And we have a lot of fun together. We try different things, give each other tips in the kitchen, and I would love to have more veterans join us. It's virtual, so you don't have to be here in Sheridan. You can be from anywhere. And then the other aspect to that is I do have some cooking kits, and there's no food items in them this year, but I do have some kitchen supplies. So if you're in need of a new pot or pan or cutting board, and lots of other fun kitchen gadgets that you may not know that you need but are helpful in the kitchen, I have a lot of those as well that I would love to get into the right hands if that would support you in making healthy choices at home and cooking more meals for yourself or your family if you're a caregiver. So yeah.
As a dietitian, Olivia, why are you offering these classes for women? Why are they necessary?
Yes, great question. So we know that how we eat, what we choose to put in our body is one way that we can nourish ourselves. And with nutrition, you know, it impacts so many systems in our body, our brain, our lungs, our kidneys, our digestive tract, our hormones that we make, our mental health, our physical health. The list just goes on. And so the more opportunities we have to eat fruits and vegetables, those whole foods in their wholest form, that can really help and make a big difference in our health. And one barrier that we might experience is, man, I don't know how to cook, or I'm not that confident in the kitchen, or I don't even know what I would make. So this class gives us that hands-on opportunity to walk through that. What would that look like? How could we make this recipe more convenient? Maybe you don't have a lot of time in the kitchen, or maybe you're trying to cook in bulk so that you have some lunches you can make for the rest of the week. So we can design a nutrition plan based on anything that you have going on in that season of life. We can base our nutrition goals and eating plans to help you out with that.
That's awesome. Thank you very much, Olivia. And did you want to give your phone number one more time, or the number that they would call to be able to schedule that class?
Yes, I'll just give my direct line. So it's 307-675-3927. And then once I get your information, I'll add you to our BBC link, and I try to offer this class once a month. And then I also offer, the VA in general. We have a great group of dietitians, but one-on-one dietitian visits as well if you're looking for personalized information based on your health and a good eating plan for you.
Great. Thank you very much, Olivia. Appreciate it. Does anybody
Yes.
have any questions for Olivia? You can hit *3 and still ask her some questions. Thank you. All right. I think Andrea had a little bit to talk to you about flu season.
Yes, October. This is Andrea. October starts our flu campaign, and just a shameless plug here for considering your vaccination status as part of your overall health plan. That if you can keep yourself well, you can also keep your loved ones well, and it's really we believe it's a good option for our women veterans to be leaders in their family, to go ahead and get vaccinated if you are willing to do so. We have flu. First of all, you can, anytime you go in for a primary care appointment, you can get your vaccination during any one of those appointments. So no appointment necessary. You can even walk into some of your primary care areas, and they would be help you with that. And then we have a drive-through flu clinic November 8th here in Sheridan. What was that time?
9 to 12.
9 to 12. So you can just stick your arm out the window and get your flu shot there. So there are other clinics available, and they are on our SharePoint. So if you have any I'm sorry, the website, not the SharePoint. So please reach out to your primary care teams or any one of us in the women's program to get more information about flu campaign. Did I miss anything, team? No. Okay.
And all of our clinics do have flu.
Yeah, and all of the clinics have the immunizations available, so there's no shortage.
And Sue, did you have anything or last thoughts or things to add tonight before we?
No, just want to thanks, Cherish. Just want to again thank everybody who joined us tonight. Thank you for your time. Thank you for your service. We want to make this town hall informational for you. We want to give you updates on the program. We want to hear from you. We want you to be involved. And so we just encourage you. We are going to be starting our newsletter again in November, December. And so if we have your email address in the system, you'll be getting those newsletters from us again. It's been a little bit since we've sent those out, so be on the lookout for those. We'll share information for you in that as well. But we just encourage you to reach out to us if you have any questions whatsoever. We are here for you, and we're very appreciative for your service and for what you have to share with us. So thank you very much, Cherish. I appreciate the opportunity to say some final remarks. Thank you, ma'am.
Thanks, no problem.
Oh, hey, and just as a reminder, if you have topics that you would like to have shared or you need out there, I would encourage you to be part of Janine's focus group or one of the to participate in those focus groups and in those planning so that we can get the information that you need and want out.
Okay, and I can give you Brianna's number again. We are nearing the end of our town hall, and Brianna's number she's good to get you hooked up with any one of our team members, and her number is 307-675-3712. And if you did not get like the Gov delivery, yes, we'd like the other day, Monday, we kind of sent out some information for veterans that goes directly to your email. It also talked about the town hall and how to join tonight. If you aren't getting that, you are invited to sign up for those emails and upcoming events by going to our homepage at va.gov/Sheridan-health-care, and you can scroll down to the Get Updates section and subscribe to the News and Announcements section, and that way you'll be told about all kinds of programs and services for veterans and women veterans alike. We'd like to thank you to everybody that participated tonight from both Wyoming and Montana, and the Sheridan Leadership Team and Women Program Team for all the helpful information and for the coordination of care that you give our women veterans. We want to thank you all for joining us tonight. Have a great evening. Thank you.
Bye.